Hello, my name is Dr. Goliaei, and I'm here today to talk about pregnancy loss and miscarriage. First, I would like to thank you, my co-contributor, the California Refugee Reproductive Health Network, or ReproNet, and the Patient-Centered Outcomes Research Institute. ReproNet was founded in 2019 to strengthen refugee academic community partnership and engage in dialogue with refugee communities about their experiences and preferences for sexual and reproductive health and well-woman care. This network includes researchers, refugee women, and health and social service providers who serve refugees. I have no disclosures. Let's get started. Losing a baby before or during delivery is an unfortunate experience for most parents. A spontaneous pregnancy loss before completing 20 weeks of pregnancy is known as miscarriage. Sometimes you may hear another term, which is early pregnancy loss. Early pregnancy loss is a miscarriage that specifically happens in less than 13 weeks of pregnancy. The first fact that I want to emphasize here is miscarriage doesn't mean that the carrying the fetus was problematic. Most of the time, pregnancy loss and miscarriage happen when not everything is in the place for development of a healthy baby. For example, most of the time, the embryo is unviable and had not developed properly. This could mean miscarriage is the natural way of preventing the birth of babies with multiple malformities or genetic disorders. So miscarriage is often the result of genetic malformations and not because the mother couldn't carry the fetus. Pregnancy also may terminate anytime after the full 20 weeks of pregnancy. This termination after pregnancy is known as a stillbirth. A stillbirth can happen in about 1 in 160 births. The cause of a stillbirth is mostly unexplained and can happen before delivery or during the labor. A typical sign of a stillbirth is decrease in the baby's movement. So call your doctor immediately if you noticed your baby moving less than usual. Miscarriage is the most common form of pregnancy loss and can happen in all families with any level of education, ethnicity, culture, religion, or income. Early pregnancy loss is common. In the United States, data indicated that miscarriage is as common as 10 out of 100 known pregnancies could terminate due to miscarriage. So this number could even be much more because most of the time mother still is not aware of being pregnant and the pregnancy could terminate in miscarriage. So miscarriage is more common and can happen in all families. Why does miscarriage happen? At the beginning of this session, I emphasized that the miscarriage could be nature's way of decreasing the chance of the birth of unviable embryos. Pregnant women who lost their babies always look back to find what they did wrong and why they caused miscarriage. But miscarriage almost always is not the mom's fault. And I'm emphasizing here that routine activities like picking up your older kids, working around the house, exercising, having sexual intercourse, or pregnancy's morning sickness usually does not cause a miscarriage. There are some risk factors that may increase the risk of miscarriage. Remember, they are not the cause, but they can increase the risk. One of these factors is mother's age. As mother getting older than 40 years, it may increase the risk of miscarriage. Other risk factors could be certain medical condition in the mother, such as diabetes or thyroid disease, certain type of infection, and some abnormalities in uterine and cervix also could increase risk of miscarriage. Smoking and using lots of alcohol and drugs also can increase risk of miscarriage. So miscarriage almost always is not the mom's fault. Most scientists' studies indicated that taking birth control pills before pregnancy does not cause an early pregnancy loss. If you are using IUD for contraception, there is no reported association with increasing miscarriage in the future pregnancies after the safe removal of IUD. However, if you are on IUD to prevent pregnancy and you become pregnant, that unplanned pregnancy may be terminated by miscarriage. So if you're experiencing a miscarriage and took oral contraceptives before conceiving that was not the cause. What are some symptoms and signs of miscarriage? Miscarriage may have different signs and symptoms. If it happens at a very early stage that mother wasn't aware of the pregnancy, it may not have any significant symptoms. If a miscarriage happens to a pregnant woman, she experiences any of these symptoms: mild to heavy vaginal bleeding, severe cramps or belly pain, worsening or severe back pain, fever, along with any other above symptoms, passing tissues that look like blood clots from vagina. So if you have these symptoms, contact your doctor immediately. They will tell you to go to office or an emergency room. Depending on what happened during the miscarriage, a pregnant mom may need medical or surgical treatment. If an incomplete miscarriage happens, which means the mother passed some parts of tissue and placental materials, but some remains in her body, then there is up to the doctor to decide on the next step. If the mother does not show signs of infection, one option is to wait and let the tissues pass naturally. Prescription of oral medication that helps expel of the tissues is the second option. Sometimes surgery is recommended, especially when there is a sign of infection, heavy bleeding, or other medical conditions. Surgery could be in the form of using a vacuum procedures or dilatation and curettage, DNC. It is the DNC or curettage is the procedure in which the doctor uses the cervical entrance to the uterus and removes the tissue from the inside of the uterus. When to have the next baby? As we discussed, early pregnancy loss or miscarriage is a one-time event related to that embryo's chromosomal changes. So repeated pregnancy losses are usually rare. Testing and evaluation can be done to find a cause if you have several pregnancy losses. Even if no causes is found, most couples will go on to have successful pregnancy after a miscarriage. Many healthcare providers encourage women to wait at least a few months so they can strengthen their bodies and increase the chance of next healthy pregnancies. So repeated pregnancy loss are usually rare. How to recover from miscarriage? As I mentioned at the beginning, pregnancy loss is painful for all the family members, especially for the pregnant mom. You may feel sad and depressed because your body experiences dramatic hormonal change along that your loss. The most important matter after a pregnancy loss for a mom is, first, to take care of your mental and emotional health. It's okay to be sad after pregnancy loss. Do not blame yourself. Ask for help. Talk to your doctor and ask for professional counseling. Join in-person or online support group. Talk to your husband or close family members or friends that you can rely on them for their supports. Sometimes maybe store the baby's clothing so that doesn't remind you of what happened. After mental and emotional health, you need to take care of your physical health too. Avoid sexual intercourse for 1 to 2 weeks after miscarriage. It will. Get rest and let your body recover. So it's okay to be sad after pregnancy loss, but do not blame yourself. What can we do to prevent early pregnancy loss? Remember, most miscarriages are one-time events and are not related to future pregnancy loss. However, sometimes we cannot prevent early pregnancy loss. Women can get support for their future pregnancy to be healthy, get regular prenatal care, eat healthy diet, do weight control and exercise, taking prenatal vitamin, avoid smoking, alcohol, using drug. These taking care of your body could help you to have a healthier pregnancy. So I just want to summarize some of the points that we learned today. First, miscarriage is often the result of genetic malformation and not because the mother couldn't carry the fetus. Call your doctor immediately if your baby is moving less than unusual. Miscarriage can happen in all families. Miscarriage almost always is not the mom's fault. If you experience a miscarriage and took oral contraceptives before conceiving, that was not the cause. If you have these symptoms, contact your doctor immediately and they tell you to go to the office or emergency room. Repeated pregnancy loss are usually rare. And then it's okay to be sad after pregnancy loss, but do not blame yourself and ask for help. Now we are at the end of this session and I want to see if there is any questions. And to evaluate what we learned in this session, I have some true or false questions, which I'm going to read some facts. And I want you to think and pause and see if what I'm reading is true or false. The first fact that I'm going to read is, if I have a miscarriage, I'm not able to have another healthy baby after that. Is it true or false? As I mentioned before, this is false. Each miscarriage, most of the time, is related to that embryo's genetic deformities and is not related to future pregnancies. Repeated miscarriages usually are rare. Second question, I did something wrong and it's my fault that I lost my baby. Is this true or false? And yes, as we mentioned before, this is false. Most of the time, the cause is unknown and is related to something well not developed. And embryo itself is not viable and is not the mom's fault. And the last question, is it okay to feel sad after a miscarriage? Yes, it's okay to feel sad after the miscarriage, but do not blame yourself and ask for help. If you have any questions or need more resources, please contact us through the ReproNet Facebook page or ReproNet email address.